Good morning. My name is J.B. Buxton. I'm the president here at Durham Technical Community College, and I want to welcome you to Durham Tech's main campus and an exciting announcement about a groundbreaking new partnership and initiative focused on education, health, and workforce development in Durham. I'm pleased to be joined at the podium today by Vice Chair of the Durham Tech Board of Trustees, Dr. Pat Ashley, Duke's President Vince Price, Dean of the School of Medicine at Duke, Mary Klotman, the CEO of the Duke University Health Systems, Craig Albanese, Associate Vice Chancellor for Community Health at Duke Health, Deb Clark-Jones, and the Superintendent of our Durham Public School System, Pascal Mubenga. And just on cue, the Board Chair of the Durham Public School System, Bettina Umstead. Chair Umstead, come on in. Before we get started here, I want to welcome some other members here with us today, also from our Board of Trustees and Commissioner and lots of other jobs, but thanks for being here today. Commissioner Brenda Howerton, also a member of our Durham Tech Board of Trustees. From our great Durham legislative delegation, I don't think there's a more supportive delegation of community colleges and education in North Carolina, Representative Ray Jeffers and Senator Mike Woodard. Board Member Javonia Lewis will probably get recognized again, but I just want to thank you and welcome to Durham Tech. I also want to appreciate our Durham Tech Foundation Board and our Vice President and Chief Institutional Advancement Officer and head of our Durham Tech Foundation, Roxanne Miller, is with us today on behalf of that board. Finally, I want to recognize that we've got some community-based organizations in the room, groups like Made in Durham, Student U, Emily K, CIS, the Boys and Girls Club, DPS Foundation, key partners for us in this work and part of what is going to make this work successful. And then finally, I want to thank my colleagues, Durham Tech leadership here with us today. I specifically want to recognize, again, Roxanne Miller, head of our foundation, the dean of our health and wellness pathway, Melissa Ockert, our chief academic officer, Dr. Kara Battle, and where is she, Dr. Olu Ario, right here, our director of college recruitment and high school partnerships, together with our colleagues from Durham Public Schools and Duke Health. These were our core leaders in doing this work, and I want to thank them today, and you're also going to get a chance to ask some questions. We also have with us, and I'm going to introduce here shortly, Jenny Kane from the Bloomberg Philanthropies. And Jenny is going to appear, as Warner Wolf used to say, by the magic of videotape in a moment over a Zoom connection from New York. But the Bloomberg Philanthropies are a critical part of this broader collaboration. We'll hear from her shortly. I believe that you can test and determine the health of a community by the strength of its institutions and the strength of its institutional partnerships. Are our institutions committed to working together on the big public challenges? Do they come together to meet unmet needs? Today's a story about the strength of Durham's institutions and our commitment to work together to address critical needs in education, health, and workforce development in our community. And it is illustrated not just by the individuals who sit and will stand with me at the podium, but the individuals in this audience and the organizations and institutions they represent, all of whom will be a part of the work we are announcing today. And so at this time, I am pleased, if we are ready to bring her in, to introduce Jenny Kane from the Bloomberg Philanthropies. After Jenny makes some remarks, Duke President Vince Price will come to the podium, and then we will follow the program as printed with a great addition of our Associate Vice Chancellor, Deborah Clark-Jones, at the podium as well. So at this time, Jenny Kane.
Great. Sorry I can't be there in person with you, but I'm happy to join you virtually. Thank you, JB. This is a really exciting day to see so much hard work and partnership come to fruition. Mike Bloomberg believes all students should have options and opportunities to get good jobs with good wages. For far too long, students have been left with one option, four-year college or nothing. And we know that both students and their parents want and need more options. There's so many well-paid jobs that don't require a four-year degree, but students need specific training and credentials to today the majority of those jobs are in healthcare. That's where this project comes in. We are excited to announce today a new partnership between Duke Health, Durham Public Schools, and Durham Tech to launch a new health sciences early college high school that will provide students with that training while they're in high school. So if they choose, they can directly enter well-paid jobs at Duke Health when they graduate. I'm excited to share that we will be committing $29.5 million to this partnership as part of the national $250 million commitment to support Durham and 9 other geographies around the country. All the players are here: Duke Health, Durham Public Schools, and Durham Tech. Our job at Bloomberg Philanthropies has been to help bring these groups together and kickstart and de-risk the project upfront with private funding. But the overall goal of this partnership and 9 others around the country is to be sustainable. And for these examples, to inspire other health systems and school districts across the country to launch similar models. As we began our search for partners on this project, Durham clearly stood out as somewhere where you should go look at. Duke University Health System is one of the largest employers in North Carolina. They've been committed to this project since the beginning and have brought tremendous leadership and innovation to its development. Durham Public Schools is a leader in career exploration and development, providing courses in many career clusters alongside career-connected learning opportunities at all high schools. And Durham Tech, which will host the Health Sciences Early College, is a national leader in community college innovation and student success. This is an amazing team, and I really want to thank you all for your partnership and dedication to making this happen. My hope is that 10 years from now, we'll be back here with hundreds of health science early college students working at Duke Health and hospitals around the country following your lead. So thank you again, and it is my pleasure to turn it over to Duke's president, Vincent Price.
Thank you, and good morning. I am absolutely delighted to join President Buxton and Board Vice Chair Ashley of Durham Tech, Superintendent Mubenga, and Chair Umstead of Durham Public Schools, as well as my colleagues from Duke University and Duke Health System, to formally announce our partnership to establish this early college high school for Durham students who intend to pursue careers in health. The partnership to create this new school is the product of long-standing, close, and collaborative relationships between Durham Tech, Durham Public Schools, Duke University, and Duke University Health System that have been forged over decades. And it reflects Duke's broad commitment to community priorities such as college and career readiness. And together, thanks to the hard work of so many people, we have created a shared vision for this early college high school to support 3 absolutely critical needs in our community. It will create a pathway for local students to pursue well-paying careers in healthcare. It will support patient care by helping meet critical healthcare needs in our community. And it will ensure that our healthcare workforce more fully reflects the diversity of our local community. It's rare for an initiative to have the potential to address so many important goals. And this is one of the most ambitious educational initiatives our community has pursued. It's been made possible by the generous support, as you've just heard, of Bloomberg Philanthropies, which has granted this partnership $29.5 million in support of its student-centered, market-driven healthcare education initiative. We are so very thankful. We're absolutely thrilled to be among the 10 partnerships that Bloomberg Philanthropies is supporting nationwide, through which local health system employers like Duke University Health System and education partners will create specialized healthcare high schools that meet the needs of their communities. We'll soon begin working to build the infrastructure that will enable students to enroll in our early high school, our college high school in the fall of 2025. And following their graduation from this wonderful program, we expect the majority of students to begin their careers at Duke University Health System in fields including nursing, allied health, surgical technology, and in clinical research. We're grateful to the Bloomberg Philanthropies for supporting this vital work, and we're delighted to embark on this purposeful partnership with our colleagues at Durham Tech and Durham Public Schools. Above all, we are so excited to be building a future that will support education and creative career pathways for Durham students, and that will enhance the health and well-being of everyone in our community. Thank you so very, very much. And now I'm delighted to turn the podium over to our Executive Vice President for Health Affairs and Dean of the School of Medicine at Duke University, Mary Kloppman.
Thank you, Dennis. I am beyond thrilled to be here, but even more importantly, beyond thrilled about this project. I have been from the first day. Deborah Clark-Jones introduced it to me, and I thought, you know, I run an office in the School of Medicine where people come in every day with ideas. Most of them are pretty good. This far outshined any idea I've heard in the last couple of years, so I am absolutely thrilled. It simultaneously will transform both the lives of hundreds of students, young folks, that participate in the program, but also Duke Health's care and clinical research enterprise. This is really a mutually beneficial partnership. I want to thank the Bloomberg Philanthropies for the Visionary Healthcare Education Initiative and the tremendous support to get this project off the ground. I also want to thank the leaders of Durham Technical Community College, the Durham Public Schools, and all of my colleagues in Duke Health and their creativity, really remarkable creativity and tireless effort that brought us to this point, which is just the beginning. And I think we're so excited about that. As we all know, the healthcare industry is in a time of enormous change. I've been in this industry for a very long time. It feels like every year we say that, but this is extraordinary. And one of the biggest pressure points is our workforce. There are just not enough technically trained, skilled workers to fill the jobs that are not only available today, but that will become available in the future. So the vision of this program will make an enormous difference in closing that gap. It's a strategic pathway that will present students with a diverse array of career opportunities in healthcare, filled with excellent job opportunity, competitive compensation, opportunity for continuous learning and personal growth, and the fulfillment of having a positive impact on people's lives. At the end of the day, it is our mission, and it is our mission that inspires us. It's not only an investment in the future of our students, it's also an investment in community health. As these young graduates, they will become part of the workforce that cares for and is committed to the health and well-being of our community. I want to briefly mention one of, I think, the most innovative aspects of this program, which is the pathway for motivated, talented young people to enter high-demand positions in clinical research in the School of Medicine. That is I would say, a less understood pathway, but an exciting pathway that merges all of our missions. It's about clinical care, it's about education and training, it's about research, which is one of our core missions, and it's about community partnership. So that is very, very near and dear to my heart. Clinical research is essential for building medical knowledge, developing effective new therapies, and improving patient outcomes. The partnership we announced today is a bold step forward toward addressing those growing needs in healthcare and nurturing a generation of health professionals. And I am thrilled to be a part of it. Now I'd like to introduce Craig Albanese, who's the Chief Executive Officer of Duke University Health System, an extraordinary leader, strategic partner, and also a cheerleader for this program. Craig?
I forgot my pom-poms.
Rhonda has.
Yes. Good morning, everybody. It is just a pleasure to be here as we celebrate this transformational partnership, and sincere congratulations to us all. Really, we should be so proud as we put our heads on the pillow tonight and wake up tomorrow and thinking about what we're doing for this community. This community deserves this, and we're really indebted to Bloomberg Foundation for their generosity. You know, Duke Health is just proud to stand with Durham Public Schools and Durham Technical College course supported by Bloomberg Philanthropies, to advance the health and well-being of this wonderful Durham community. Duke Health is a proud member of this community and a servant for this community. As is stated before, this effort will afford the Durham Public School students an early entry into a unique pathway into a career in healthcare. They'll be prepared to step into impactful and meaningful roles and will have an advantage in the form of college credits as they advance in their careers. They'll have professional network built through the connections they make in the classroom, through mentorships, apprenticeships, clinical rotations, and other work-based learning. At the same time, they'll be helping to build the area's healthcare talent force. That's a term that my colleague Rhonda Brandon coined for Duke Health, talent force, not workforce, talent force. And advancing economic stability for themselves and the community. Importantly, this initiative advances health equity. As one of North Carolina's most diverse communities, Durham deserves a healthcare talent force that reflects its beautiful community. Research has consistently demonstrated that patients fare better when healthcare teams mirror the diversity of the community. Access, outcomes, and the healthcare experience all improve. So within 5 years of its establishment, we expect that our new health sciences early college will be providing its rigorous education and training to more than 400 students, pursuing careers in the fields of nursing, allied health, surgical technicians, and clinical research. The need is very, very real. For example, in less than 10 years, North Carolina is expected to be one of the 5 states with the highest number of nursing vacancies. To make that even more real, if you look at Duke Health, just last year alone, we had almost 5,000 nursing openings, 1,300 openings for nursing care assistants, and hundreds more openings for imaging, sterile processing, and surgical technicians, and entry-level clinical research positions. Our graduates will make a profound and lasting impact in the community, for the community. This community deserves this. So congratulations to us all, and now it's my pleasure to introduce Deborah Clark-Jones, Associate Vice President for Community Health at Duke Health. Deborah is a visionary leader who leads efforts to leverage Duke Health's role as a university, as an employer, and provider of healthcare to enhance community health and address social drivers of health. Thank you, Deborah, for being Duke Health's on-the-ground leader at our Health Sciences Early College. I turn the podium over to you, and thank you, everyone, and thank you to Bloomberg, and this partnership is truly transformational, and it really warms my heart. I'm so happy to be a part of it. Thank you.
Good morning. I too would like to begin by thanking Bloomberg Philanthropies for this remarkable opportunity. Thank you, Craig and Mary, President Price, my good friends, President Buxton and President Mubenga, for your leadership and your unwavering support and commitment. I also want to recognize Stephanie Williams, Vice President of Duke Community Affairs, for your support and leadership across a whole host of different areas that help to improve this community. Thank you. Our mission in Duke's Office of Community Health is to advance health equity by addressing the most persistent social barriers in our community, including barriers to a good education and barriers to good jobs. We do this through partnerships with incredible community partners such as Durham Technical Community College and Durham Public Schools. I'm extremely proud to lead this effort on behalf of Duke Health. I am even prouder of the project team of partners who pull this proposal together and work tirelessly, and I do mean tirelessly, to get it over the finish line. You each deserve to be recognized, but I'd like to take this opportunity to recognize just a few of the leaders on the team, and President Buxton has already recognized a few: Melissa Okert, Olu Ario, Julie Pack, who is not able to join us today, she is the Senior Executive Director of Career and Technical Education and Magnet Programs at Durham Public Schools, but April Thompson is here with us today from the project team. Pamela Edwards, Assistant Vice President of Nursing at Duke Health. Stephanie Friel, Director, Clinical Research Operations and Education within the Duke School of Medicine's Office of Clinical Research. Allison Gordon, Assistant Vice President of New Talent Strategies at Duke Health. These are just a few, but I just want to give you all a flavor of the type of partnership and collaboration that we have been engaged in over the last several months. Finally, I must acknowledge two highly supportive human resources executives. We would not be able to do this work without you. Antoine Lofton, Vice President of Human Resources and Chief Human Resources Officer at Duke, and Rhonda Brandon, our rock star. Where's Rhonda? There she is. Senior Vice President and Chief Human Resources Officer for Duke University Health System. Craig said it best. This initiative is about advancing health equity and the economic stability and economic mobility of those we serve in our community. In the midst of critical shortages lie great opportunities for dynamic careers in healthcare. The establishment of this early college is an excellent example of how we partner and leverage our respective strengths to achieve the greatest measurable impact in the communities we serve. Each entity cannot do it alone. We improve community health and maximize impact by working together as partners, strategically, intentionally, and purposefully, something we are all committed to. Thank you, and now I'd like to invite our partner, Durham Public Schools Superintendent Pascal Mubenga, to offer remarks.
Good morning. Good morning. I'm super excited on behalf of 32,000 students that we serve in Durham Public School. Cannot imagine about the opportunities that's waiting for them. Let me first of all go ahead and introduce or acknowledge some of my board members here. Giovanna Lewis, Natalie Bayer, Vice Chair Emily Chavez, and I know our board chair was introduced as well, Bettina Armstead. And I'll take also this point of privilege to acknowledge our County Commissioner that just arrived, Nimashima Burns as well. Good morning again. I stand before you today with great excitement and pride as we embark on a new chapter in the history of Durham Public Schools. Today we present a bold step toward the future as we lay the foundation for the next generation of healthcare professionals in Durham through the establishment of Healthcare Careers-Focused Early College. This is a game changer for DPS, its students, and Durham. And I thank Bloomberg as well for advancing the mission of public education. An educator goal is to equip students with knowledge, skills, and experiences that will allow them to realize their full potential. This grant, along with the commitment of our partners, facilitate the realization of the goal and student pathway to a prosperous future. This is a gateway to a meaningful and fulfilling career by the way of a high-quality education for all our students. DPS will be able to support the demand for skilled professionals in every growing healthcare sector, allowing us to align educational opportunities to meet the critical need for more healthcare workers right here in our community. Students will have the opportunity to earn industry value credentials and certification as well as college credit while in high school by participating in enriching hands-on learning experiences, mentorship programs, and internships. This unique model will provide real-world insight and practical experiences and a network of support of our students as they navigate the educational and professional journey. We believe in unlocking the limitless potential within each student, irrespective of their starting points. And this initiative is a tangible expression of that belief. The early college is designed to be a win-win for families and the community. All students will complete a program at no cost, saving thousands of dollars for students and families. Upon completion, they will then propel into high-wage, in-demand careers locally. Moreover, I'm confident that the early college will not only nurture the intellectual growth of our students, but also foster a sense of purpose and responsibility within them. Our collective efforts will not only shape the future of these aspiring healthcare professionals, but will also contribute to the overall well-being of our community. Thank you to Bloomberg for this investment in Durham Public Schools and the Durham community. I'm equally grateful to our partners at Duke Health and Durham Tech as well. This is yet an example of ongoing collaboration between our institution that is rooted in opportunity and advancement for our students. I would also like to thank the Chair Board of Education, Betty Armstead, and our board members here that I studied them earlier, many of whom are present today, as well as our district leaders. I see my Deputy Superintendent here, Dr. King, and others that are sitting in the back. Dr. Deborah Pittman, thank you. Julie Pack is not here. She's been very instrumental making this project go through. April Thompson, again, thank you for your work. Together, we are setting on our students on a trajectory of success and service. And again, thank you, and we look forward to a bright future that awaits our students in a transformative educational journey. At this time, I will turn the podium back to President Buxton.
I want to add my thanks to Jenny Kane and Bloomberg Philanthropies for their transformative investment in this work, but most importantly in this community. I just want to recognize, and I think my colleagues have said it well here, yes, this is a groundbreaking education and talent force initiative. And it's a great story of educational innovation, but it's a great story of making college a reality for more young people in our community. It's a great story of creating a high-quality pathway to some of the most important jobs in our community. It's a great story about how we ensure that our healthcare workforce looks like the patients it serves, and it's about increasing the quality of healthcare and health outcomes and health equity in this community. In short, it is the story of Durham coming together to improve people's lives. And so as we look to tell that story even more deeply, we're going to give you, our media partners, a chance to speak to some of the individuals who are deep in this work, and most importantly, some students who have been through this pathway in their own way. Former students at Durham Tech, now working at Duke Health. And so I'm going to give you a few instructions about how we're going to do some interviews at a few different stations in here, give you a few names, and then we'll conclude the press conference. Over at the Durham Public Schools banner, we'll have April Thompson, the Director of Choice and Innovative Programs, and Dr. Deborah Pittman, Assistant Superintendent for Specialized Programs. At the Durham Tech banner over here, Dr. Oluwa Rio, Director of College Recruitment and High School Partnerships, Julian Davis, Assistant Director of College Recruitment and High School Partnerships, and our Dean, Melissa Ocker, Dean of Health and Wellness. And then at the Duke Health banner over here, Deborah Clark-Jones and perhaps a few colleagues, but Deborah will be there at the Duke banner. Joining our colleagues at these banners will be 5 or 6 of our students who were given time off to be here today. Thank you, Duke Health, for doing that. Steve Nicolason in nursing, Jacqueline Margalis in nursing, Heather Nobwood in nursing, and Shannon Dodd, nursing, Janice Lee in surgical tech, and Shelley Fincannon, clinical trials. They can answer questions about their experience coming through these pathways at Durham Tech and now working in these incredibly important and fulfilling roles in nursing, surgical tech, and clinical trials. And with that, I thank again my partners for this work. It is now beginning, and I thank you for being here with us today.